This presentation is not intended nor approved for use as a continuing education course for dental health professionals or as part of a certification course for coronal polishing. Welcome to Coronal Polishing, all about cleansing removable prosthetics, Coronal Polishing Part 4. So first we need to recognize a removable prosthesis in the oral cavity and how we can manage these removable prostheses, how they can be cleaned. So first let's look at some photos that appear to have very nice teeth, very nice dentition, but on closer inspection you will see that these are indeed full dentures. So on occasion a patient might be scheduled in an office for a prophy as in California as the RDA. You may be asked to polish. However, usually someone catches that the patient doesn't actually have fixed dentition. They actually have a denture, which really makes our job a little easier. So also by looking in the vestibule, you can see the edge here of a denture. You would also see a change in the color of the gingiva. Usually, lab techs are very good at matching the acrylics to the gingiva, but they're not always exact. So you can see a little color shade or color difference, shade difference, and it would be a little bulkier. Another identification of a prosthesis would be any metal. So here we have metal clasps, a very good indication that this person has a partial denture. You can see in this photo a lingual bar, and so definitely there is a prosthetic device here. Other prosthetic devices that you may encounter, other devices, removable devices, would be something like a mouth guard. And we do have techniques for cleaning a mouth guard as well. Now, to clean an appliance, whether it be a removable prosthetic or such as a denture or a mouth guard, the first explanation here or process is actually a questionable practice in the world of infection control. It consists of putting the denture in a sealable baggie or sealable bag with some denture cleaning liquid. And then we take this seal bag and you put it in your ultrasonic cleaner, but make sure the ends, the top end, hangs out of the ultrasonic unit. So it's a questionable practice because what if you have a hole in your baggie? Usually our ultrasonic cleaners are they're not sterile, they have contaminated liquid. So it's a very questionable practice. If you have a lot of patients that have removable appliances, you may want to invest in a small ultrasonic cleaner, although those cannot be sterilized, but then you would have a more controlled area than a regular ultrasonic cleaner that you're using for all of your instruments. You can use a denture brush and an abrasive. You could also use pumice with a rag wheel on a lathe. And these are probably your best options. Sometimes the denture might need to be scaled in order to do a cleaning for the appliance and remove any deposits, any calculus that may be on the device, on the appliance. Well, that concludes how to recognize removable prosthetics or prosthodontics in the oral cavity. You want to keep them nice and clean for our patients. Nice and clean. The end. Thank you very much, and I hope you learned something.